Welcome to our session, a guide to the Income Stabilization Program for FHO physicians. Did you know that you can get financial support when you first join a FHO? The Income Stabilization Program, also known as the IS program, was developed by the Ministry of Health to provide financial support for physicians who have joined a FHO or a FIN while they develop patient rosters prior to converting to the group-based blended capitation model. This means that you receive a guaranteed compensation rate for up to 12 consecutive months upon commencement of your membership with the FHO or FIN, provided that you meet each monthly enrollment target. How much compensation is provided? With the IS program, you must meet requirements for patient enrollment, patient treatment, and after-hours services. Here is a chart on how much you will be compensated depending on your full-time equivalent or FTE ratio. For example, you will be compensated around $200,000 in an urban area if your FTE is 1, which is a weekly service commitment of 40 hours a week and 5 days a week. Who can sign up for the Income Stabilization Program? There are 5 key requirements that physicians must meet to be eligible for the Income Stabilization Program. First, you can only sign up within 3 years of your graduation date. After 3 years, you will not be eligible for the Income Stabilization Program and will instead be transitioned to a signatory member. In addition, you must have no prior history of being part of any patient enrollment model, including FHO, FIN, FIG, CCM, or have a current roster. You can only join within your first year of fee-for-service billing in Ontario and are not taking on any number of patients from any other provider. Lastly, you can only use the IS program once. So if you have already participated before, you are not allowed to register for the program again. Please note that some exceptions may apply, so do feel free to contact us if you have any questions whatsoever. What are the patient enrollment targets? Once you are signed up in the IS program, you will be required to meet monthly enrollment targets set by the ministry. Here is a chart that illustrates the targets that a physician must achieve throughout the course of 12 months, depending on their FTE ratio. If you do not meet the enrollment target requirements, the ministry will send you a notification within your first month. By the second month, if you have not achieved your monthly targets, you will be terminated from the IS program, and you will transition into a signatory member of the FHO or FIN. Monthly enrollment targets are cumulative, so the ministry recommends that you proactively enroll more than the target amount to account for vacation, illness, or patients who are derostering. Now, what are the patient requirements? The patients that doctors enroll must either be new patients or unattached patients. So how are new patients defined? A new patient must meet one of the following requirements. The patient has not previously been enrolled as a patient to the group or a physician in the group. The patient's family physician has moved to another community. The patient has moved to another community. The patient's physician is no longer available due to illness, death, retirement. The patient's physician is no longer available due to change of practice type, or the patient has not had nor felt the need for a family physician. Now that we know what is defined as a new patient, what about an unattached patient? An unattached patient requires the same criteria as the new patients, in addition to one of the following. The patient is a newborn admitted to a neonatal intensive care unit within the last 3 months and is not already enrolled with a physician, or the patient was an acute care patient in a hospital within the last 3 months, previously without a family physician. Now that you understand the patients you need to enroll, how do you enroll them to your roster? To enroll the patient must agree to be under your care and sign the enrollment and consent form. Once the form has been signed, submit the Q200 code for non-long-term care patients or the Q202A code for long-term care patients with the IS physician's FHO or FIN group identifier number, and use the date the patient signs the form as the service date for the claim. Once the claim has been processed, it will automatically link the patient's health card number to the IS physician's billing number on the ministry system, thus electronically enrolling the patient to your roster. Since the enrollment form is no longer submitted by the ministry, the last step is to distribute one signed copy to the patient and keep one at your office for audit purposes. It is important to note that enrollment claims should be submitted at least 5 days before month end to ensure accurate processing. Remember to always check the group error report to ensure that your Q200 or Q202 claims did not reject due to billing errors. If you need any support with your billing errors, please feel free to contact us and we can help you with that. Once you have enrolled your patients and are providing services to them, you must submit a claim for every service you provide. So how do you claim your services? Physicians will need to submit FHO claims using the group identifier as a prefix to his/her billing number so that the IS claims will be paid according to the program billing rules. This is important to note as the payment claims must be completed through the FHO group account versus your solo account when you are in the IS program. If the service is provided in a FHO or FIN practice office, all services provided by the IS physician to both enrolled and non-enrolled patients will be paid at $0 with an explanatory code I2, which means the service is globally funded. For services provided outside of a FHO FIN practice office, there are differences for enrolled and non-enrolled patients. For enrolled patients, all services will pay at $0 with an explanatory code of I2, service globally funded. For non-enrolled patients, you will be paid fee for service or based on the contract of the group you are working under. Let's go through some important points to keep in mind when considering signing up to the Income Stabilization Program. If a physician meets their annual enrollment target before the 12 months of the IS program is complete, they can choose to leave early by providing a minimum of 30 days written notice to the Ministry of Health of his or her intention to terminate participation in the program. When a physician ends participation in the IS program, he or she will be transitioned to the FHO or FIN as a signatory member and will be compensated under the terms of the FHO or FIN agreement. A physician can change their FTE ratio at any time, but must provide a minimum of 30 days prior written notice to the ministry of the FTE change. It takes the ministry a minimum of 30 days to stop the program, and targets need to be met or exceeded before changing your FTE or coming off the program. All changes take effect on the first of the month. For example, if a physician provides written notice to the ministry on August 15th, requesting to terminate participation from the IS program, the change will not take effect until October 1st. When you are enrolled in the IS program, you are not eligible for premiums, incentives, or special payments available in the FHO FIN agreement, with some exceptions, including the unattached patient fee, Healthcare Connect complex vulnerable patient fee, and new patient FOBT positive colorectal cancer increased risk fee. And lastly, the doctors on the IS program are not limited to a fee-for-service hard cap like FHO signatories are. Now that you've learned how the Income Stabilization Program works, you may be thinking, where and how do I sign up? If you are looking to join a FHO or are part of a FHO and are interested in learning more about the Income Stabilization Program, we can help. At Doctor Care, we support approximately 25% of all FHOs in Ontario and have helped many physicians register for the Income Stabilization Program. We can help you every step of the way to make sure that you get the financial support you need when you first join a FHO. Once you have been signed up with the Income Stabilization Program, we will help monitor your patients and let you know the right time to leave and support you with the process in leaving the Income Stabilization Program once you have successfully developed your roster. Looking for more FHO group support? If you're a doctor looking to join a FHO, we can help guide you through the process in addition to setting you up to the Income Stabilization Program. Contact us today and get a complimentary transition analysis. We will do an income analysis to show you the value that you will receive by switching over to the FHO model. If you're a group doctor looking to add physicians to your existing FHO, we can help you find physicians and add them to your group to meet the 6 physician requirement as required by the new Physician Services Agreement. We hope you found our guide on the Income Stabilization Program for FHO physicians helpful. If you have any questions or have any feedback, feel free to email us at info@drcare.ca anytime. We're Doctor Care, and we can help simplify your billing.